On this edition of Primetime Politics, the federal government announces more travel restrictions to try to deal with the Omicron variant. Our MPs panel will be in to discuss the new measures. We'll hear from a medical expert on what we know and what the new measures may do. And the head of the Canadian Medical Association discusses a new study showing the wider impact of the pandemic and the thousands of additional deaths in Canada caused by medical backlogs. I'm Martin Stringer, sitting in for Peter Van Dusen. Tonight, we start with an announcement from the Trudeau government, which has added 3 more countries to its travel ban. Air passengers from Nigeria, Egypt, and Malawi now join those from 7 other countries from Southern Africa, which were announced on Friday. In addition, all air travelers arriving in Canada, regardless of vaccine status, with the exception of those arriving directly from the U.S., will now have to have a PCR test at the airport and self-isolate until they receive a negative result. Here's Health Minister Jean-Yves Duclos speaking at Tuesday's press conference.
What is most important in the context of COVID-19 is the application of public health measures and vaccination for all Canadians. These are the measures that make a difference when it comes to the biggest source of COVID-19 challenges, which is community transmission. So we know it's difficult for all Canadians, but we know that all Canadians see that there is hope. And there has always been hope as we successfully in Canada, compared to many other countries, go through the crisis in better ways, just both from the economic side, but also from the health side.
Joining me now are 3 MPs from the different parties. Francesco Sorbara is a Liberal MP for the Toronto riding of Vaughan Woodbridge. Stephen Ellis is a Conservative Deputy Health Critic and the MP for Nova Scotia riding of Cumberland Colchester. And Taylor Bachrach is the NDP member for the BC riding of Skeena Bulkley Valley. All 3 of you, thanks and welcome to the show.
Good evening.
Let's start with you, Francesco Sorbara. The biggest change in this announcement today is this mandatory testing at the airport for travelers coming from anywhere but the U.S. How do you think Canadians are going to respond to this new measure?
Well, thank you for that question. I think first and foremost, we know as a government, all Canadians know that the pandemic, the top priority for all governments is the health and safety of all Canadians. And we continue to monitor the evolving situation that is confronting not only Canada, but all countries. Yes, today, as a part of a number of prudent measures announced, anyone flying into Canada not only will have to take the pre-departure PCR test, but landing at at an airport in Canada, they'll have to do an arrival PCR test. And it's just another layer of protection that we're putting into place. Obviously, again, reflecting the evolving situation with regards to the pandemic. It's keeping Canadians safe, first and foremost, ensuring that we can continue to recover, but the health and safety of Canadians remains our top priority.
Okay, how do you think people are going to react to it, in a word?
Well, I think I think Canadians will react very positively. First off, the cost of taking the PCR test when individuals arrive at the Canadian airport, say, for example, in Toronto at GTAA, will be borne by the federal government. Okay. It's another measure, and it's a very prudent measure that reflects the change in circumstances, but also is ensuring the health and safety of Canadians is our top priority during this pandemic.
Okay, Stephen Ellis, for the Conservatives, your reaction to the additional measures announced today?
I think one of the things that we're concerned about as Canada's Conservatives is understanding the very slow rollout that the Liberals had at the beginning of this pandemic. And even with this new variant, the big concern that we had was Friday morning we had to make statements to help guide this government. And for us, that's, in a word, frightening. You asked for a word. And I think the other thing that concerns Canadians, of course, is are we going back into lockdown stage? We know that the economy can't stand that anymore. We know that the stimulus that the government has provided has caused significant amounts of inflation. And when you look at those things combined together, as I said, the word for Canadians is frightening.
But the measures themselves, you have no problem with what has been announced? You welcome what has been announced?
As I said originally, I think the big thing is Friday morning that the comments that we came out with very early in the morning were those that the government has adopted. And any time that the government adopts the position that we've suggested to them, of course, we would be very those.
Okay, on behalf of the NDP, Taylor Bachrach, what do you make of this and your reactions to the latest measures?
Well, we need to ensure that as a country, we're acting in a way that's precautionary. I think that's the biggest thing. Stephen mentioned the quickness of the response, and that's so important. Looking back on the first wave of the pandemic, there was a lot of criticism that Canada's response at the border wasn't rapid enough, wasn't decisive enough. I think we've seen an improvement, actually, this time around. But now the onus is really on the government to explain, why certain countries are being added as opposed to others. And we need to be talking about the bigger question here, which is that with the arrival of on the scene of Omicron, it's really underlining the fact that nobody in Canada is safe until everyone around the world has access to vaccines. And, it's inexplicable why Canada continues to oppose the patent waiver at the WTO that is one of the things that will help get vaccines to people in developing countries and protect everyone around the world. So that larger international picture is very important, even as we deal with the immediacy of these border measures.
Okay, Francesco Sorbara, I want to ask you a double-barrel question. First of all, one of the things, as we're going back to earlier in the pandemic, one of the biggest problems that your government faced was that you didn't seem to allocate enough resources at the airports. We all have memories of the Ontario, Quebec, and Alberta governments sending testing teams to their airports in Calgary and Montreal and Toronto because there weren't enough resources. Are there going to be enough resources for this in-airport testing, and also the wider issue of vaccine equity and trying to encourage the WTO to waive intellectual property rights?
Thank you for the question, and thank you, Taylor, for his comments. First off, with regards to vaccine equity, we know, and every government knows that we will not defeat COVID and we will not defeat this pandemic until every country has access to the vaccines and can get their populations vaccinated. We understand that, and obviously we've committed, I think it was $2.5 billion in terms of helping internationally. For the COVAX facility, another 200 million vaccines will be donated to that facility. Canada's been at the forefront internationally in working with our international partners, whether it's in the G7 setting, the G27, and further settings, in ensuring that countries around the world can vaccinate their populations. We are there at the table with real resources. Secondly, in terms of comments that was made earlier on, we reacted swiftly on Friday. We reacted prudently to the evolving situation regarding to the pandemic, and we put in very prudent measures.
What about the other question, though, about resources? I'm just going to cut in. What about resources? Because are we going to see bottlenecks at the airports? Are we going to see long waiting lines?
I think what you will see over the next days to come, as we put in place these measures, are the necessary and sufficient resources to keep Canadians safe, to ensure that we can keep our economy open, we can keep Canadians working, and that we can keep going on the way of a recovery. It's very, very important. We will have the necessary resources in place that Canadians can be confident that testing will take place expeditiously, that they can go home very quickly, await their results, and then proceed to their daily activities.
Okay.
Absolutely.
Stephen Ellis, any questions still outstanding for you in terms of this issue of this new variant and the measures?
Well, I think there's very many questions that need to be answered and answered quickly for Canadians. We need to understand, is the vaccine still going to be effective against the Omicron variant? What is the likelihood of community spread with the Omicron variant? We also need to understand very, very clearly what is the likelihood that people are going to be hospitalized or end up in the ICU due to this variant. Those are questions that are going to be very, very important to Canadians. I also think that the other questions that are important to Canadians that we need to have answered are, why did the Liberal government take 1.6 million doses out of the COVAX program? Why is there this significant amount of inequality with countries that are in developing nations? We need to have those questions answered, and we need to understand very clearly why the government is not ameliorating this situation. I think the final question that we need to answer when we talk about agility is, we are now attempting to vaccinate children in our country, and we need to understand, are we going to have the resources to also continue to vaccinate with a third dose those people who are vulnerable populations? So those are outstanding questions that, again, very concerned about.
Okay, Taylor Bachrach, a last word to you. Anything outstanding? Mary Ng, the International Trade Minister, and Francesco Sorbara saying that Canada is leading. They say they're playing a leading role on the international international scene to try and further with the waiving of international property rights and get more vaccines available.
Well, here's the reality. We continue to, as a country, Canada continues to oppose the patent waiver at the WTO, and the United States under President Biden is supporting that waiver. So I think there's some explaining that needs to be done on why we're still acting as a barrier to getting those vaccines to developing countries. The second question is in these new border measures, the treatment of travelers coming into Canada from the United States. And obviously the measures announced today don't apply to folks traveling to Canada from the United States. And I think there's some questions around that as well. All
right. On that note, obviously we'll be discussing this more. I want to thank all three of you for taking the time. Thanks for speaking with us.
Thank you so much.
Well, to look at what we know about the Omicron variant and discuss the government's responses, I'm joined now by Dr. Christopher Lavos. He is a cardiologist with a degree in epidemiology. He joins us from Montreal. Dr. Lavos, first of all, thanks for joining us.
Oh, my pleasure. Thank you for having me.
Okay, first of all, what do you make of what we're hearing, the latest this latest part of the response of the government to this new variant? I mean, I think the biggest measure is this testing now of everyone except those arriving directly from the United States at the airports. What do you make of that measure?
Well, I think it makes sense. I mean, if you want to know who has COVID, the only way to do that is to test for it. And so if we are going to have people coming here from other countries, having them test negative and isolate until they test negative is just, frankly, common sense. This is what we were doing for much of the pandemic. We loosened restrictions relatively recently when things were, looking somewhat more stable. But I think the emergence of the Omicron variant has made a few people realize that COVID is not over yet, even though the situation in Canada is, pretty good. We have a high vaccination rate and we have good reason to be optimistic about the future. A little bit of care is needed and testing people when they return from overseas, whether they are returning Canadians or travelers coming to this country. I think it makes sense to test them because you don't want somebody who's COVID positive entering the country and potentially bringing new variants and infecting others with them.
But what is the advantage of at airport testing? Because, I mean, people had to submit to a 72-hour PCR test coming from wherever they're coming from. What's the advantage of having it at the airport and then you having to self-isolate for 3 days or for as many days as it takes to get the negative result?
I think it's just giving you an extra layer of protection because don't forget, if you test negative 72 hours before your flight, that's still 72 hours when you can get infected.
Okay.
And also, these tests are not perfect. There are people who have false negatives if you get tested too early over the course of your infection. So it's not inconceivable that you could test negative 72 hours before your flight and still have COVID when you enter Canada. And so having that test at the border and having people isolate until that test comes back negative just adds an extra layer of protection. It makes it increasingly unlikely that somebody would be able to come from overseas and have COVID and the Omicron variant and then introduce it into the community here.
Okay, I want to get your impression of something that we learned today, and that is that there have been cases of this Omicron variant that have turned up several weeks ago in both the Netherlands and in the United Kingdom, and one case in Germany, which is not even associated with travel. And the African countries are saying, why are we on this no-fly list when there are cases and when obviously there was a circulation before the South Africans identified this particular variant? What do you make of the way measures are being implemented and the fact that this has obviously been circulating before it was identified? Does that make any difference?
Well, and I think the point that a lot of countries are making is a completely valid one. Like, why are you targeting specific countries when you're starting to see evidence that there probably is at least some degree of community spread in a number of different countries? Don't forget, this variant was identified recently, but it's probably existed before that. The fact that it was identified now doesn't mean that it originated last week. So there probably has been spread. It is present in a number of different countries. It's very likely that there is some degree of community spread. So that means that, to have these sort of country-specific targeted approaches is probably not the most efficient way to go about this because you could have people infected with the Omicron variant coming from any number of different countries. A much more effective strategy is to test people when they arrive, because that way you can be sure they don't have COVID, or as sure as you can be given the limitations of testing, but you can be relatively sure that they test negative. Whereas if you're going to rely solely on travel bans to specific countries, that doesn't really acknowledge the reality of the fact that this variant is already present in a number of different countries that would be outside that ban.
Well, I guess the question is then, given that, for example, Canada is on a list of banned countries for Hong Kong and for the United Kingdom. So given that, and if we see, dozens or scores of cases across the world, they're cropping up in Europe, in Asia, in North America. If we see a proliferation of cases all over, does it make the designation of African countries irrelevant?
To a certain degree, probably. Once every country has the Omicron variant, it's no longer like the country-specific designations are going to become relatively meaningless. In the same way that now the designation of the Delta variant, because it's more or less everywhere, to sort of try to pick out specific countries doesn't really make sense. And this is the unfortunate reality of how viruses spread, right? They start in one place, but by the time you can identify them, unless you can contain them early, they do tend to spread globally. So again, country-specific approaches, it's not that they're completely useless, but by the time you start implementing them, when you have evidence that they've already spread to other countries, the impact they're going to have is probably, fairly marginal. And that's why you're seeing a lot of people sort of arguing that these are maybe not the most effective public health strategies we need to implement at this point.
As you, as a specialist, as someone who watches this, what are the questions that you think are the most important that you're waiting to have answered with regards to this, this variant, and that will condition how we move forward on it?
Well, I think the main ones are going to be, is it more infectious? Yes or no? Does it cause more severe disease? Yes or no? And is there a meaningful decrease in vaccine efficacy? Yes or no? So we'll see. We don't have the answers to those questions now. If it spreads more easily, that means something. But if it doesn't cause more severe disease, and if the vaccine efficacy is still fairly good against it, this may not end up being that significant an issue. So a lot of these factors are really going to determine how important Omicron becomes, because there have been other variants over the course of this pandemic, right? Some of them have been fairly significant here in Canada, like the Alpha and the Delta variant, but a lot of the other variants, like the Lambda and the Mu variant, weren't actually big. They weren't big players here in Canada. So just because this variant is new and just because it has a lot of mutations in its genetic code doesn't necessarily mean it's more dangerous. It doesn't necessarily mean it's going to upset the equilibrium of our current epidemiological situation. So there's still a lot of unknowns here, which is what makes dealing with the Omicron variant so difficult, because we simply don't have the data to be definitive on some of the most important questions. Okay,
I want to get you to weigh in on this issue, and it's a hot issue, and it was referred to by federal officials again today. The federal government, as well as the provincial governments, are revisiting boosters and when they should speed up eligibility, or if they should speed up eligibility for a third dose of the vaccine. Some are for it, some are against it. Some say, why not wait until we know whether an Omicron-specific booster is necessary. Where do you come down on this?
I don't think we have enough information to be to really know what the best course of action is. For now, I would say stick the course. I think there is a value to giving boosters to high-risk individuals, so people who are very far away from their second dose, which in Canada tends to mean people who are older, people who have pre-existing medical conditions, healthcare workers. I think that's a reasonable group to offer boosters to. But if you're otherwise young and healthy and have no real medical issues, it's unclear how much benefit you're actually going to derive from a third dose. And it's not that giving people a third dose isn't beneficial. There is a benefit to it. But if you're giving a booster shot to somebody and getting a very, very marginal improvement in their immunity, we have to think that it would probably be better for the planet if you gave that vaccine dose to somebody who doesn't have access to vaccines. And that's when we get into the issue of vaccine equity, where you get more benefit by giving somebody their first dose than you do from giving somebody their third dose. So it's not that boosters are bad or that they don't work. There's obviously a benefit to it, but we have to start thinking globally. is it going to be better for us in the long term to share vaccine doses so that the whole planet can be vaccinated, so that we don't have unvaccinated populations, so we don't get new variants in the future? I think what Omicron has really done is highlighted the issue of vaccine equity and made it so that people are realizing, look, if we don't get vaccines to these countries, new variants are going to emerge. Yeah. Now, there's nothing to say that we can't do both of those things in parallel. We totally can, but we have to be more mindful of the fact that some of our vaccine supply has to start going to countries that don't have access to vaccines.
Right, and of course the calculation changes as well. If we find out that the Omicron virus is largely resistant to our existing vaccines, there will be a great demand for a new retooled vaccine to give boosters to people in Canada.
Right, actually, exactly. And I mean, one of the advantages of mRNA technology is that it becomes relatively easier to formulate new vaccines as the virus changes. So, making a new mRNA vaccine specifically directed against the Omicron variant is going to be a lot simpler than if you were using more traditional vaccine technology. So that's on the plus side. Of course, there's a number of caveats to that. Number one, we have to see if they're actually necessary and beneficial. If they are, we can do that. And of course, that will change the whole calculation. And of course, if it turns out that the vaccines are just as effective against Omicron as they were against Delta, then that's going to change the calculation too. So there's so many variables that go into this that it's really hard to make any firm conclusions at this point. Overall, though, I think if you look at the balance of probabilities, I mean, again, I'm generalizing a bit, but I think things are going to be okay. There's a lot of factors in Canada that argue for an optimistic assessment of the situation because, again, we have a very high vaccination rate. And even if the vaccines are less effective against Omicron, we have to remember that vaccines are not binary. They're not, completely protective or absolutely useless. Yeah. Even if there's a slightly decreased effectiveness against Omicron, it likely still will offer a fair degree of protection. And so the Omicron variant may not spread and probably won't spread as quickly in Canada as it would have in a country where vaccine uptake is very, very low. So the situation in South Africa may not accurately reflect what the situation in Canada would be if the Omicron variant starts spreading and having community spread.
Dr. Christopher Lavos, thank you very much for taking the time.
My pleasure. You take care.
A new study says thousands of Canadians have died because of COVID-delayed surgeries and lack of access to doctors. The study, conducted for the Canadian Medical Association, found that during one 4-month period alone, the number of deaths in Canada was almost 4,000 people more than normal. The Medical Association says the results of the study show the wider impact of the pandemic, and they paint a picture of a healthcare system in crisis. Joining me is the president of the Canadian Medical Association, Dr. Katharine Smart. Dr. Smart, thanks for joining us, first of all.
Thanks for having me.
This higher death rate, just to be clear, these are deaths. These are not the deaths caused by COVID. These are other deaths.
That's correct. Those are excess deaths across the country that would not have been expected based on previous years and what we've seen. And these are people that have not died due to COVID, but we suspect due to other health issues that maybe were not able to be dealt with in the system due to capacity issues and access to care.
What have you found in terms of the causes of death that have gone up, this excess death, as you call it?
The report doesn't comment directly on the exact causes of death, but what we know is it appears to be a range of things. There's people that have struggled to receive acute care when they've been ill due to capacity issues at hospitals. We've seen outcomes in terms of people's cancer progressing because of limited screening and access to surgery. And then, of course, opioid deaths have been a really huge increase throughout the pandemic, with upwards of 20 Canadians a day losing their life to overdose.
The study actually focuses on certain backlogs. What kind of things are harder to access? What kind of backlogs are we seeing?
Mm-hmm. So we look specifically at 8 different procedures: knee and hip replacement, cataract surgery, cancer surgeries for the colon and the breast, as well as diagnostic imaging such as MRI and CT scans. And across these 8 procedures, we saw a very significant backlog, over 350,000 opportunities for care missed, and an estimated cost of $1.3 billion just to address the backlog of those 8 procedures. So, of course, we know there's other procedures that Canadians have not had access to. So that's really just a snapshot of how dire things have become.
The study also talks about people not getting, people with chronic serious conditions not having access to regular in-person patient consultations with doctors.
That's right. We've seen many Canadian physicians pivot to virtual care, which has been incredible and needed during this pandemic, or the access to care issue would have been even more substantial. But due to issues with, safety in offices, abilities to social distance, access for clinic-based physicians in terms of PPE, in-person appointments have been much more limited. And there's absolute concern about the impact that may have had on people with chronic illness.
How are doctors doing too, though? Because some of it too is discretionary. How are doctors doing in terms of returning to in-person consultations?
I think we're seeing a range. I think all of us are aiming to see patients in person when it's needed and blending that with virtual care to keep our office spaces safe and our patients and staff safe, and of course the people that come to our clinics. And I think that's something, that we're needing to figure out as the pandemic moves forward, how to blend virtual and in-person care. I think people are doing their best to get their patients access, but we also know there's 5 million Canadians who don't have a family doctor, and that in and of itself is a huge access issue, particularly for people struggling with chronic disease that then are challenged to access other aspects of the system. So there's really, I would say, no part of our healthcare system that's not struggling right now or hasn't been impacted by the pandemic.
Quick question just about certain regions of the country which were in dire and acute crisis. I mean, just about a month ago, we were seeing Alberta, Saskatchewan, Manitoba. We also saw several of the territories in real acute crisis. How would you describe the situation right now in those provinces where the situation was so dire just a few weeks ago?
No, absolutely. And, I think the real lesson there is that when we move away from public health strategies too early, it is not a good idea in terms of the impact on the health system. And this is, I think, something that we really need to keep in mind, especially as we're facing a new variant, the severity of which is unknown. So I think what we're seeing in those provinces is things are starting to stabilize somewhat in terms of ICU capacity, but the impact on the system in terms of other people's care has been huge, and they're facing additional backlogs in terms of offering other surgeries and procedures that patients need. So it's going to be a real struggle as they move through the winter.
You've been quoted as saying that what's been happening until now has been Band-Aid solutions to help us get through the pandemic-induced crisis, but that the system continues to decline. Can you explain that?
Yes, I think, what we see is so often health is a political hot potato. The federal government wants to blame the provinces want to blame the federal government. And what we're left with is tinkering around the edges of a system that hasn't worked well for a long time. If you were to speak to anybody who works in the system, they would tell you we have been struggling for years to give patients the access to care and the quality of care that they deserve. And physicians, nurses, other people in the system have really been the ones holding it up and keeping it moving forward for Canadians. But what's clear is that we need significant political commitment to reevaluate our systems of care, to modernize our healthcare systems, and to actually invest in systems that can create sustainability for Canadians. We didn't have that before the pandemic, and now it's much worse. And I think it's very concerning as we move forward that if we don't get serious about the healthcare system in Canada, the implications for Canadians are going to be extreme.
We've been told that we're just days or weeks away from a federal, provincial, territorial first ministers and other ministers meeting a big summit on healthcare transfers. The provinces and territories, as you know, are asking for a 28% increase from Ottawa. What do you make of it all as you watch in the days leading up to the summit?
Well, I hope that this summit is an opportunity for levels of government to come together and actually commit to action. I hope a report like we released today will help them better understand both the short and long-term impacts of the pandemic, and that we can start moving towards a real spirit of collaboration and action. And that's what I hope comes out of that summit.
Okay, last question. With Omicron, this new variant now rearing its ugly head, are you concerned that this kind of discussion might get temporarily bumped off again because of an acute crisis caused by a new variant?
I think this report really shows that we need to balance the acute issues facing the system that are very real and ongoing, but not forget about what's happening behind that. If we don't get serious about actually solving the issues in our system and we just continue to only address COVID, we are going to have an unprecedented health disaster in this country. So I think now is really the time for the federal and provincial governments to get serious about solutions for the system and move forward with action.
Dr. Katharine Smart, thank you very much for speaking with us.
Thank you for having me.
Well, that's it for this edition of Primetime Politics. I'm Martin Stringer, sitting in for Peter Van Dusen. Thanks for watching and have a great evening.